Clinic in London. Good to have you with us.
Hi there.
So it has to be said that both the US and the UK have dropped the ball when it comes to testing their own citizens for COVID-19, unable for whatever reason to offer extensive coronavirus testing and contact tracing. Why have these two nations failed so miserably to do this, and why is extensive testing so important during a pandemic?
Well, it is just so hard to ramp this up from nothing to the kind of volume and level that is needed now. There are essentially two kinds of tests. There are the PCR tests that are used to tell if the virus is actually present. We've seen big increases in capacity and speed with which these tests can be done, but we're nowhere near the volume that's required. And to create this out of almost nothing is very hard. We've got to. I'm just not sure whether governments, any government really, has got the skill set that's needed. It's not just the production of these tests, it's the management, the implementation, the handling of the results, what you do with the information, how you interpret it, how you react to it. These are skills that take a long time to hone, and I'm not sure that government as it stands is capable of managing that. I think what's needed, rather than constantly looking back at what we could have done better and how things were done wrong, is to develop a coherent plan for what can be done moving forward to get us out of this mess. And I think what's required is a much more collaborative involvement in experts outside of government, in the medical sector, in public health, in business, in the supply chain, the whole mass of skills that at this moment of lockdown are sitting idle. We've got the brain power and the ability to bring lots of people together to help manage this crisis. We can't expect that people, civil servants, politicians, have innately got the skills to handle this kind of crisis.
Right.
I wish
the only problem with that is we have seen Germany do it, we've seen Taiwan do it, Australia, New Zealand, so many other countries have been able to do this. But if the United States and the UK don't have extensive testing and contact tracing in place, then how wise is it to open up the country, as the US is preparing to do, despite having the highest death toll in the world at more than 40,000 right now?
Yes. Well, so the countries that you mentioned have done this from a base of being much better prepared and having rather different systems. I think that in that respect, what we need to be able to do is to watch what they've done and to learn from the experience of other countries as the situation evolves. It is very hard for us, to watch them emerge from lockdown and think we can just do the same without putting in place much more by way of testing and infrastructure to deal with that. And I think also there's a problem because we've had a certain period of lockdown, and I think what's happening in the US shows that you've got to find a way to carry the public with you on this. You've got to make a good case for the lockdown continuing, and you need scientific input that people can trust and follow, and that's really the only way. But improving the level of testing and the quality of tests. I mean, the other kind of test is the antibody testing. We really are at a very early level to know what those tests mean and how best to use them.
You make a very good point about taking people with you, because you may have seen pictures and video of protesters out on the streets in Michigan and other states pushing to get the country opened up and rejecting stay-at-home orders, all in response, in actual fact, to tweets from President Trump, calling on these very same protesters to liberate themselves against his own administration's recommendations. So, as a doctor, what are your thoughts when you see those protesters shoulder to shoulder, ignoring calls to social distance, protesting in the midst of a pandemic?
Well, it's all very deeply depressing. I think the other thing that people may not realize, looking at the United States, is that we think of the United States as one country, but the circumstances in each state and in each city are entirely different. That you can't compare New York to rural, I don't know, Midwest. Each of these states is at a different point in the curve, and that's why a lot of expert advice and opinion needs to be sought, and we need a collaborative approach to inform each state of where they are and what needs to be done. And appealing to the populace in this way, I think, is incredibly counterproductive.
No, you're absolutely right. Dr. Richard Dawood, thank you so much for joining us and sharing your insight. Appreciate it. So is it possible to have had the coronavirus and not